there's only going to be so much we can do short term, and we really need to set some long-term goals.
Why is this problem still ongoing with ERs?
There's been a number of changes in the way physicians practice, the type of jobs residents are looking for when they're finished and starting practicing.
Hmm.
And I mean, all of these things kind of contribute to some of the problems we're having, not only in the rural areas you talked about, but also within our urban areas as well.
And how much more acute is it when it comes to rural areas where there are, there's a fewer number of hospitals and people then have to travel much further?
The one that you're speaking of now with regard to
Mm.
Chetwynd, when they do close, patients are expected to drive, I think it's 103 kilometers to their next hospital, which would be Dawson Creek. And as you can imagine, if you're sick and in need of care, that's an awful long way to go.
Yeah.
So, that's not just happening in Northern Health, but also, as you mentioned, in Interior Health and on the island as well.
What are those long-term solutions you think we should be pursuing?
SFU, for instance, now has a medical school, so I
Mhm.
think that's helpful. The government has opened up new nursing spots as well, but again, these are things that we are not going to see for a while. We need to look seriously as well at some of the other programs and some of the ways to offload our patient population that doesn't need emergency services.
Mm.
So, for instance, when there needs to be a system in place, and in fact, funny enough, the section and Ministry of Health and a number of other partners have been looking collaboratively as a way of how we can get patients when a call is placed to 911 to really understand, does that patient need 911 services? Do they need perhaps detox services? Do they need mental health support? Is there somewhere else other than the emergency department that might be more beneficial to the patient and allow our departments to decant a bit to allow us to do the work that we were kind of designed to do?